Welcome. My name's Josh Cabana, Director of Enterprise Partnerships at Arcadia, and I'm looking forward to chatting with you guys about quality today. In my role at Arcadia, I get to work with market-leading health plans, delivery networks, ACOs, and in that capacity, I've gotten to see quality programs from just about every angle. Whether that's care teams and providers managing quality in the clinic, whether it's health plans that may be looking to achieve a particular STARS rating or outcome, or most importantly, and let's not forget the patient, who ideally is the one benefiting from the structure and the guardrails that a good quality program enables. But we know that the real world is messy, right? Not every quality program looks the same. What I'd like to do today is talk you guys through what I've seen as a typical quality stakeholder experience, because I think we can do better collectively. I'll talk through some challenges and things that have worked really well, both from a data and from an operations perspective. And what I'd like to leave you guys with is sort of a view of what an optimized quality program could look like for stakeholders that are involved. This isn't prescriptive. We know all organizations are different, but what I'm hoping for today is that you guys connect with some of the challenges that I'll describe that I've seen in the market when running quality programs. And if I can leave you with some tools or different ways of thinking about how to optimize those, that would be great. So let's start with the typical experience, right? And some of the friction that comes along with that. I guess the challenges really depend on who you are and how you're involved in this process. We've got the care team, right? We've got the provider who is managing quality at the point of care. They're certainly measured on quality. They're probably incentivized on quality as well. We've got the patient. They're the ones getting notifications and phone calls and reminders to get their screenings and schedule appointments, and they're engaged in this as well. And then you've got a payer who's interested in maintaining a quality standard for their members. Potentially they're looking to achieve a particular STARS outcome. So you've got a whole range of stakeholders. With that, in a typical experience comes challenges, right? And stop me if any of these don't sound familiar. Stale data. Claims data and reports that are based off claims data can be lagged up to 3 months pretty regularly. That leads into actionability. It's really hard to make decisions or take actions based off data that's 3 months old. So I've worked with plenty of customers who have care coordination functions, folks that are trying to reach out to patients and help them navigate the system, get scheduled for an appointment. And they'll have a list of 20 patients, and they'll call down the list and maybe get 3 or 4, or on a good day, 5 that they can help with. Frustrating experience. Feedback loop delay. So a provider in a clinic takes an action. They order a screen, they order a lab, they get a result, and they don't see that reflected in their quality measure within days. Often it's weeks or months, and they have a real hard time managing, am I doing the right things and moving the needle in the right direction? Trust issues, right? That provider, especially if part of your compensation is based on this and you're getting a scorecard at the end of the month, do I trust the data that's in there? Is it right? Is it wrong? There's so much lag that I can't really tell. Trust issues also from the care team. I see this person in the numerator, I see them in the denominator, but I don't really know why. Do I believe it? And lastly, care team confusion. If you're in a clinic, is this a United patient? Is it a Blue Cross patient? Is it an Aetna patient? What quality measure was I supposed to focus on again? Is the inclusion or exclusion criteria slightly different? Hard things to keep track if you're a care team in an office. So let's talk about what you can do from data perspective, where the challenges are and how you might think differently about that with tools and approach. So one key here is timely and comprehensive data. We want to cut that feedback loop down. And the key here is getting as much clinical data integrated into the quality picture as you can. At Arcadia, we connect to EMRs and we pull down that data daily. So it gives a much tighter feedback loop and another source of input to help the care teams manage this quality process. Trusted and validated, right? So we take an approach that from day one, we want to make sure that people believe the data, they're comfortable with it, they trust it. And we do that through a pretty rigorous validation where we compare reports that you guys may have access to, whether they're payer provided or something you have in-house, compared to what Arcadia is calculating off of the raw data. And we're not necessarily trying to make it a one-to-one match, but we're trying to explain why there might be differences. It could be data sources, right? If you have claims and clinical data feeding one report and the other report's just based off claims, you're going to have misalignment. Could be data drift. Are both of those reports that you're comparing based off the same data at the same time, or was one generated a month ago and one was generated yesterday? We have expert teams that walk through that and sort of identify on a person grain, why is this person showing in the numerator or denominator, and build that trust with your network so that this data is actionable and something they can rely on. And the last piece here is maintained. So once you've got that initial data set that you trust, how can we keep it up to date and current over time? What we do is we actually feel really strongly about providing a self-service tool so that you guys can map terms as data and workflow in your network change. So a really good example is diabetes management. I've seen results tagged as A1C, HbA1c, hemoglobin A1C, hemoglobin A1C, but hemoglobin misspelled, right? And all that kind of goes to A1C as you're calculating quality measures or looking for those relevant results. What we do is provide a self-service tool that scrapes all of that out of your EMRs and provides smart suggestions that you guys can look at and confirm or change. But at the end of the day, you can accept it or make modifications in a self-serve way so that you have a current data asset that's feeding into your quality measure calculation over time as workflows change. A stakeholder that we haven't talked much about in quality, I don't know if any of you guys are in data, but your data teams. Depending on network complexity, generating supplemental clinical feeds to payers can be a huge administrative lift. If you've got multiple EMRs in your network, reaching out, managing contacts, managing data, coming inbound, shipping that off to a payer in a way that they can understand. What we offer is actually we have this data that's aggregated, it's validated, it's trusted. Let's take the burden off you guys having to manage your network and ship that out to payers in a standard format that they can consume, that they can get regular insights into quality performance of the network, and it takes a lot of the lift off of your plates. We've talked a lot about data. I'll switch gears to operations quickly before I sort of close with the final vision here. So operations, there's two key things that I've seen organizations that are successful in this do. Number one is clarity, right? If you are in a multi-payer, multi-contract environment, and there's slightly different quality measures in each, and they have all different tweaks to the inclusion and exclusion criteria, if the operational and clinical leaders in your delivery organization can get together and build a core set of operational measures that all the frontline staff who are delivering this can focus on from day to day, understanding that performance in that core set of measures flows up into all the different contracts you're trying to manage, that can provide some real clarity and efficiency at the care team level. And with good data, this is hard with bad data, but with good data, it gives you a foundation for full care team participation in quality, starting with care coordination and navigating patients through the system, getting them scheduled for appointments, getting them set up for screenings. Pre-visit huddles in the clinic, your care team can understand who's on my schedule and what do I need to do with them, who's not on my schedule and should be, and have a really efficient pre-visit huddles such that the provider can really focus on the patient that's in front of them in an appointment and not have to worry about is this data accurate or valid. So I'd like to close with, with those factors, if we think a little bit differently about data and operations, how can we optimize the experience of all the stakeholders who are involved in quality? So imagine this, right? I'm a patient, I'm due for a screening, maybe it's a colonoscopy or a mammogram or an annual wellness visit that I'm due for, and I get a call from a care coordinator. That care coordinator can help me schedule an appointment. Maybe they have access to some social determinants data about me. They can say, hey, do you have any concerns about getting to this appointment? If so, maybe they could work with me on transportation. I'm super happy as a patient, right? Because I feel it's not a spam call. I don't have to tell them, hey, thanks for calling, but I had that screening 2 weeks ago. You just don't know about it yet. I feel like there's someone in my corner helping me navigate the system. The provider takes action, they document in the EMR, they might order a screening, order a lab. That feedback loop is rapid. They see that reflected in their quality measures in days, not weeks or months. They have trust in the data when their provider scorecard lands at the end of the month, especially if incentive compensation is based on it, right? They're not questioning, is this right or not? And the payer, with the supplemental data, gets a good, proven, consistent feed of supplemental data where they can have visibility into the quality performance in their network and sort of manage that across the year instead of finding out after the fact. So I'd prefer this experience. I think there are tools out there that can help take the typical experience and sort of upgrade it to something like this.